day, right? Just a casual Saturday. All I can think about is how fun and exciting business is. Like that's the main thing that's been going through my head because I've just been getting so many ideas. I've been working on my coaching program. I was getting a new idea, but thinking in like making like a program for patients too, like guide to depression, like complete guide on healing depression, complete guide on healing anxiety, complete guide on healing bipolar, like doing like a guide for patients where patients can log in and literally like look up stuff and things. So that's what I was thinking about. And yeah, no, it's just exciting that there's a lot of like it literally just came to me today, and I was like, yeah, because I got the idea from doing the lives actually, because like answering question on lives, and I was like, well, what if I just made like here's a complete guide to healing depression, and then this is what okay, here's the therapy stuff you can do, therapy home exercises, here's the medications you can try, here's the meds you can ask your doctor about, et cetera, et cetera. So yeah, that's what I was thinking, and yeah, so a lot of a lot of exciting ideas coming. Um, makes me think like wish I just had more and more time, But right now the NP coaching, so that's what's coming first, and then once that's developed, once I mean, it is pretty much developed, but I'm just adding in new modules, new videos and stuff every day. And once that finishes, like fully, I'm sure I'll keep adding in more and more stuff. But once that is done, then I'm gonna focus on the more patient focused one. So it would make my mental health happier to feel change my eye color. That's so funny. My sister said the same thing because my mom has blue eyes, and we have the rest of us have brown eyes, and so we're like, Mom, like why didn't we get your eyes? Uh, but it is what it is, right? That's something we can't really change. So if you can't really change something, then you just accept what it is that you have. That's the most important thing. Can you explain the glasses? So these glasses are for uh, dry eyes, and basically that's what it's for. So I was able to get off all of my dry eye medications from these glasses. So definitely check that out. I have a link in my bio as well for these glasses. I got sponsored by the company because I wear them every single day, and it's the only thing that I ever would ever consider like sponsoring, just because I wear these every single day, and they've changed my life. I was able to get off all my dry eye medications that I was getting shipped over from India because they were expensive here. So yeah. Will my psych get upset with me if I want to up my Adderall? If you have a good relationship with them, I would just tell them that you're not noticing the benefits. So, yeah. Cancer, yes. I am indeed a cancer. Yeah. Birthday coming up in a couple months. You should do an anxiety recovery coaching program for those who can't access therapy. That's a good point. Stuff like anxiety recovery, depression recovery, um, OCD recovery, that type of thing. Um, maybe maybe kind of like a Netflix for mental health. I like that, Netflix for mental health. Netflix for mental health. Yeah, that's what I'll call it. Maybe I'll call it like level up patient. Getting all sorts of ideas, and just basically just have all the different courses and programs available. So yeah, yeah. Netflix for mental health. All right, I like it. I like it. Bro, why is this dude spamming stress? Maybe he's talking about cancer. I think the astrological sign of cancer. Yeah, because like that's how I at least interpreted. Wellbutrin cause seizures. I mean, that's a very common thing. Seizures are very common with Wellbutrin. Okay, not. I take that back. They're not very common. They are. They can happen with high doses, and if you're prone to it. I think it's fine. I think it's Wellbutrin's a good medication. I think it's fine. So, uh, yeah, no, I think it's a good medication. It's very commonly used, and it's really helpful for energy, mood, motivation, that type of thing. So would definitely recommend, if you struggle with those things, it's a good choice. Just have to be careful about seizures. What's the best solution for people with exam and test anxiety? Uh, so if you're talking med wise, probably propranolol. If you're talking more natural wise, something you can do is replicate the testing situation. So for example, when I was studying for like med school exams, what I would do is literally, so there's a med school exam you take called step 1 and step 2, and those exams are like 8-9 hour exams. And basically you'll take it for an hour, like you'll do 40 questions for an hour, then you could take a break, then you do 40 questions, then you do 40 questions. So it's just questions back to back to back. And so the way I practiced or to help with anxiety was like I would have practice days where I literally would just simulate the exam day. And by simulating the exam day, like the full 9 hour exam day, like I would just do practice questions throughout the whole day, then that helped a lot because I'm actually simulating that actual experience. Of course, being prepared helps too. If you're prepared for the exam, then that can help. Because a lot of times people feel anxious because they're not really prepared and they're like, oh my God, I'm going to fail. So, having a comfortable level of preparation can help too. What's your go-to medications for women with ADHD and bipolar? You need to stabilize the bipolar first. So I would stabilize the bipolar with a mood stabilizer or an antipsychotic. Then I would use a stimulant, but only after. Hello, good afternoon. You typically have a sweater on. Do you get cold? Yeah, I do get cold. I run very cold-blooded, or I guess it's cold-blooded. But yeah, so I have a disease called brainouts too, so I have low circulation. So actually, if you look here, you can actually see like my fingernails are kind of blue, especially here. So I just have low circulation overall, and yeah, I just get cold easily. So yeah. And plus, I live in Michigan, or right now, at least I'm in Michigan, so that doesn't help either. Real life lizard, exactly. I actually used to work with lizards back when I was an undergrad. I did research with lizards specifically, and my job was to go and clean the poop of these lizards, especially when I first started, and we had about 100 lizards and like 50 different cages. So every couple days I'd be going in there, wiping down the poop that they would have, wiping down the branches, and like the like there was like little like wooden sticks and stuff that were set up. And every so often I would find lizard tails because they would shed their tails, or like they would pull on their tails because there were two lizards in each cage. Or sometimes like I would be like, so we had to measure the lizards too for part of this experiment we're doing. We're measuring their growth. So as I'd measure the lizards, sometimes I would grab it by the tail and they would just run off, and then like the tail would just be on the ground. So that can happen. So that thankfully doesn't happen to me. They bite. Yes, the lizards do. I see you have the daddy inside you. LOL. Do you prescribe Prestige for GAD? Yeah, I do. I do. Yeah. It's common. It's basically like Effexor, except it's a little bit simpler. Is Ativan 1 milligram 3x a day safe to take? I wouldn't take three. I mean, I wouldn't do it for a regular time, maybe once in a while, but not like every day, all day. Come to Toronto. So I'm actually from London. That's where I grew up. So I do have some family in Toronto. I got put on Effexor, and now I'm scared of when I want to come off of it. Yeah, so it is hard to come off of it, but I wouldn't be scared about it, right? Like with proper tapering, you can come off, and it's not a big deal. I would not smoke and take lithium. Those would probably they would conflict with each other. Best treatment for insomnia. So you would do CBT-I. I mean, that's called cognitive behavioral therapy. for insomnia, so you can definitely do that. That's good. I mean, if you're talking med wise, I like if you have if you have a mood condition or something that we're also treating, I like Seroquel a lot. But if we're just doing pure insomnia, then I like Trazodone. Those are my go-tos, usually. Why does starting SSRIs feel so yucky? So, for starting SSRIs, the reason it sucks a lot is because it hits the serotonin flooding everywhere. And so one of the things it does is it increases serotonin in the gut. So in the gut, it sucks because then, it can cause some diarrhea and some nausea. And in the brain, it's like a big influx of it that your brain's not used to. So that's what can cause some of those cognitive effects too. Do I look up because you see a map of your brain? No, it's just how I think. There's actually some evidence that when people look in specific directions, they're accessing different parts of their brain. So I think it's like if you look up to the right side, you're accessing your like factual memory, but if you look up to the left side, you're accessing more like creative thinking. There's something like that. But I look up when I'm thinking. Good question. Most commonly prescribed SSRI, most commonly is I like Prozac personally. Look straight, you'll be able to see your ptosis. I would not want to see my ptosis. Bro, are you a doctor? Nah, I just pose. I'm just a poser. Is that related to EMDR? No, EMDR is like a eye movement desensitization. Basically, the theory behind EMDR is that when you move your eyes back and forth, and you think of a traumatic memory, it integrates that memory across your brain, and essentially it decreases the affective intensity of it, meaning that it decreases how strongly it affects you. And I think of it like when you move it across your eyes back and forth and you think of that thing, you're integrating the memory rather than it being locked into one part of the brain. It kind of gets spread out, so it gets diluted, so it doesn't affect you as strongly. That's the way that I think about it. Have I ever taken a psychiatric med? I have not. I have tried. I think I tried Xanax one time. I tried Visceral one time. I tried Adderall maybe twice. But yeah, that's about it. I've never taken any other meds. I've always been stable, at least from a mental psychiatric standpoint. So I've never needed to, but I have taken hair loss meds, dry eye meds. So we all have our problems. How was Xanax? I just got sleepy with it. I don't really struggle with anxiety, so it just made me sleepy when I tried it. Don't scrunch your eyebrows. Your dermatologist will get mad. No, I don't scrunch my eyebrows. I think my skin's pretty good, so I'm okay with that. Well, lucky you. Hair loss meds, finasteride and minoxidil. Those are the top two. Yeah, see, I mean, we all have our issues, right? It's, there's plenty of people who don't have any hair loss issues. There's plenty of people who don't have like confidence issues. There's plenty of people who don't have dry eyes and wear like funky glasses like me. So we all have our issues, right? Come to Long Island, New York. I don't need Botox. I think my skin is plenty fine, but I appreciate the offer. Awesome, Amna. Thank you for the sub. My son has to be up for school and Trazodone makes him sleepy. 50 works, but 25 doesn't. So you could try 37.5 as well, too. Basically, 1.5 of the 25. Yeah, you could try 37. How do you deal with fear of depression with anxiety? I'm not sure what you mean. How do you deal with fear of depression with anxiety? Is there a way to make 500K as a psych? Yeah, you just work more. I mean, you work more clinical hours, but if you're trying to scale any business, then, eventually you have to stop, you have to create assets and you have to remove your time from it, right? I mean, of course, you can just see, plenty of psychs makes, if you're just taking pure Patient care, plenty of psychs make over 500K. They have multiple jobs, they have a lucrative private practice. In psych, you can stack jobs pretty easily. So you could have a day job, you could do weekend gigs, you can do night gigs, overall night call gigs. So for example, right, like last year, like I had even like a couple months ago, I was doing my main gig during the day. And then I was doing my prison moonlighting in the evenings, and I was doing psych moonlighting, and then I was doing my private practice stuff in the evenings and weekends, and then I do social media. So all of those things can stack up. Can you tell me about those glasses? Are those for dry eyes? Yes, so those are indeed for dry eyes. They're dry eye glasses, yeah. They've been a game changer for me. The fear that you won't be happy again, research too hard for meaning in your life. So that sounds like you have to be more involved in the present. Something I've learned is that life is from being in the present, not in the past or the future. Because there's a saying that like anxiety comes from thinking about the future, depression comes from thinking about the past. Only in the present is there, only in the moment is there peace. And that's so, so true. You definitely don't have a girlfriend with that schedule. Nah, I'm married to the game. What acts as the quickest for a psychiatric standpoint? East the quickest. I'm worried about LASIK too. I've never had LASIK, and I never will. My eyes are way too sensitive for LASIK. What is mania in bipolar 1 and 2? Mania is basically when you have an elevation of your mood. So you're grandiose, you're talking too fast, you're thinking too fast, you are impulsive, you might be spending too much money, having hypersexuality, you don't sleep for days on end. That's what mania basically is, and it can be dangerous. Do you think alcohol is terrible for brain health, or is a little glass of wine okay? I mean, the way I think about every substance is that in any medication is that there's pros and cons, there's benefits and there's risks, right? So benefits you get from, for example, alcohol, you feel good, it helps you connect with your friends, you enjoy things, like you enjoy social moments more, right? But then the cons are hangover, addiction risk, long-term brain health consequences. So you just weigh those pros and cons. And if you decide that the pros are worth it and the cons for you, then you lean in that direction. Obviously it's not good for you, but we're all human beings. So I know that I've always hated the doctors who just like answer like robots. They're just like, oh yeah, don't do it, it's bad. But meanwhile, you know that they're doing dumb stuff behind closed doors. And I've seen it from the medical side. So I don't think you should be as pretentious, right? Everyone's got their own vices. I'm not here to judge them. But with every substance, you just make a risk and benefit calculation. That's it. Yeah, are you accepting new patients? So I am, yes. So if you want to work with me, then you can book a consult in my bio, and we can see if we're a good fit to work together. How do I feel about Buspar for anxiety? So I actually just made a Buspar module today in my nurse practitioner coaching program. So that's funny. I literally just recorded it. But yeah, I think Buspar is decent for anxiety. I don't think it's a magical fix like some people like to think it is. But I've had some psychiatry attendings who think it's useless, which I don't think it is either. Basically, it's like an augmentation to help with anxiety. You can add it onto an SSRI. It works decently. Maybe you'll get like a third of the improvement of an SSRI. A third to 50%. Are antipsychotics good for high-functioning autism in any way? Maybe not high-functioning, but it can help with the irritability for low-functioning. Nurse practitioner? Yeah, NP, nurse practitioner. Yeah, that's my coaching program. Buspar gave me chest pain. Oh, I'm sorry. Dang. Did I look up any more info on inositol? Dang, no, I forgot. I need to do that. I wrote it down, too. But I didn't make a square about it. See, I literally wrote it down, inositol. But normally I'll make a square for it to do, and I didn't. See, you want just for you. I'm going to make a square. So boom, that's done. Okay, what the heck is this spam? What are examples of hypomania that are different from mania? So hypomania is, think about hypomania like here and then mania like here. So hypomania is like it lasts shorter amount of time, but hypomania is like you spend $1,000 on an Amazon shopping spree and you're asleep for a couple hours and you're more focused in your work, and you're talkative, but you're still pretty functional. You just have this burst of energy. Mania is like you spend 10 grand on Amazon, you drive halfway across the country, you quit your job because you're like, F this, you don't sleep at all, or you sleep like an hour max and you literally can't sit still. So it's just a more severe version of mania or hypomania. Hypomania doesn't need hospitalization really, but if you're manic, like for example, one of my patients, she was driving an EMS vehicle at like 120 miles per hour, and her coworker had to ask her to pull over, took over, and then brought her to the hospital because she was manic. So like it becomes dangerous. So that's the best way to think about it. I have panic disorder. Thanks to Zepbound, is it possible to heal with no SSRI meds? Yeah, I would. Yeah, of course, right? Panic disorder tends to be a little bit harder to treat than just like pure anxiety. But you could try Buspar. Buspron's a good solution. You can try propranolol as well. That could help some of the heart rate anxiety as well. You can try exposure therapy. So you just have to work at it a little bit differently. Best things to review or best book for an incoming psych resident. Best things to review or best book. Well, congratulations on that. Yeah, honestly, the DSM, like I would just know the diagnostic criteria pretty well, like understand that. There's a psychiatric interview book by Carlat. I would read that as well too. Those are probably the top two things. Understand how to diagnose. Do you think there's truth in doctors' handwriting that's hard to read or just a stereotype? Well, if I put up my handwriting right now, can you read this or is it too hard to read? It may be inverted, so I'll let you have it. Will you explain dosing for lithium, bipolar, SI, mood, also lab monitoring? Yes, yeah, so I will. Yeah, so I'm gonna make a video in our coaching program on detailed lithium too. So I haven't got to the mood stabilizers yet. So today I made videos on the anxiolytics. So I made a video on Buspar, Vistaril, gabapentin. I made video on cogentin, some of the the side effect blockers, flumazenil. Yeah, so those are the videos I made today. And so, but lithium definitely needs to be on the list too, like mood stabilizers. So my next order of business, which I'll write down right now, actually. So, mood stabilizers. So that will be next in in the coaching program. But lithium is definitely an important topic. Also, we're going to be having our process group tomorrow too. So hopefully we can, I'll see you for that, Diana. Awesome. Yes. Yeah, absolutely. I'm glad that you're in it. I want to make it the, oh, whoops, rip. Yeah, my goal is to make it the best uh, psych education program in the country. So definitely, I'm glad it's been helpful. And every every day I'm like adding in new videos. So yeah, that's the plan. Yeah, so all the details about the coaching program, yes, so I do coach NPs as an MD, that's correct. And all the details are in my bio, so you can see that. I have been on antidepressants for 30 years. Oh, rip, I just lost the question. Oh my god, it's a thing. Yeah, I need to analyze why there's a pattern. I don't think my handwriting's that messy. Yeah, I don't think it's that messy. Okay, like look at this, see if you're able to understand that. Like I don't think that's messy too. Does recurring thoughts mean you have OCD? Only if they're highly distressful, right? It's all in mental health, it's all about the distress that it causes. That's the main thing. Your handwriting is easy, don't worry. Yeah, I don't think it's that bad, to be honest. Like I think it's fine. Whatever. It looks like I do write small, yeah. I do like conserving paper. When I would have those like full sheets, like back when I was in school and stuff, I would always write single spaced on both sides and relatively small. Whereas I had friends who would take up like 2 lines just to write. Is biting your tongue or lips until you bleed, even though it hurts, considered as OCD? It can be, yeah, because it's similar in line to like hair picking or skin picking. So it just depends on how much stress it causes you. If it's like a little bit and it's just anxiety, then it's fine. But then if it's too much, then that can be where it becomes like an intrusive type of thought too, and it becomes seriously problematic. Do I think AI will replace docs? No, I think AI will just become helpful for medicine. People still want that human connection. Yeah. If you have schizophrenia, do you have to take meds? Yeah, usually. It's one of the hardest conditions to treat, especially, and people become non-functional with it. How do you treat appetite loss on Vyvanse? Uh, you make sure you eat beforehand. You can eat after. You can also use cyproheptadine to stimulate appetite as well. I love AI, no shame. I use AI for my business all the time. Yeah, so it's fine. How many types of schizophrenia are there? So now it's just one type, but it used to be divided into a bunch of subtypes like grandiose and religious and paranoid. Uh, there's like a negative symptom subtype, but right now we just classify it as schizophrenia. When to come off antidepressant? Whenever you want, whenever you feel like things are good. How do we know a referral to functional medicine? What do you mean, how do you know a referral? Like, how do you know when to refer to functional medicine? Is that what you're asking? What is cyproheptadine? It's an appetite stimulator. We often use it for kids who take stimulants. Yeah, so I refer to functional medicine if I have any kind of treatment-resistant case. So, for example, a lot of the OCD cases I'll refer, especially if I suspect there's an underlying pandas or some kind of acute thing, or is like underlying inflammatory thing. Patients who have just, example, I had another case who had treatment-resistant panic disorders. Actually, tried various meds, and so she wanted more of a functional workup, so I did that with her as well. Basically, you refer to functional medicine if you suspect any kind of immunologic issue, you suspect an immune issue, you suspect mold toxicity, Lyme toxicity. Those would be the main things that functional medicine does. I've spent a lot of time actually, like at my old job, right? Like I worked with functional medicine doctors, so I would refer patients to them, and I would always look at whatever their diagnostic workup and treatment plans were. So yeah. Do OCD thoughts make you do OCD thoughts make you think your thoughts are always true or right? Not necessarily. They're more just like intrusive thoughts that just keep coming in again and again and again. What are your thoughts on Fetzima? I don't know what's the generic for that. I don't know what that brand is for Fetzima. We're in America. We don't have we don't have the same meds as a lot of foreign countries. I only have autism and ADHD. Should I be on Latuda? Yeah, it's good. It could be. It's good for autism, like irritability, and it's less weight gain too. So that's nice. How will the appetite help the Vyvanse? It doesn't. Vyvanse hurts appetite. I look young. Thank you. I will take that as a compliment. Oops. Oops, indeed. Kind of stuck here. My MDD is more complex. My GP is not thorough enough, but can't afford a psych. That is tough. I would definitely look at more natural holistic approaches then. Look at like a ketogenic natural diet, whole foods diet, non-processed, getting your sleep right, getting your exercise good. So I would look at those things instead. Can you use the appetite stimulant on adults? You can, yeah. You totally can. You don't have to keep it just for kids. Do you perform any pharmacogenomic screening tests in your country prior to prescribing? It depends. You don't need to if you just start something. But usually if patients fail a couple meds, that's the best time to do it. It's not the magical fix that people think it is. Sometimes I don't even like pharmacogenomic testing because it gets patients ideas like, oh, they have to take stuff in the green, which is not accurate. It has to do more with how the body metabolizes meds. It doesn't mean that it won't be as active. And once you look at enough pharmacogenomic tests, you realize that all the same meds are in the green because they just not metabolized by the things that the test looks for. So, yeah. Is it unhealthy to be working night shifts even though you sleep during the day? Yeah, I mean, it just throws off your circadian rhythm. I think long term, I think it's not that good for you to be working night shifts. Like you're just off the clock, off the sun's natural rhythm. If Lexapro stopped working for your patient, what would you try next? It depends on the patient. It's so hard to say. But probably an SNRI. Best med for ADHD over 67. I mean, stimulants are still the best med for ADHD. You can still use them in people older than 60 or in elderly people. You just have to monitor their heart and blood pressure a little more carefully. Like I have a 70-year-old patient who I treat for ADHD with a stimulant. I mean, he's he's doing well. He's a CEO of a company, so he's functioning really well. Wellbutrin and Lexapro together. Yeah, that's totally great. I order labs for zinc, magnesium, B12, 0.25 VD, cortisol, reasonable. Yeah, I also order hormones. Yeah, I'll order testosterone, estrogen. I'll upload my standard. I have a standard integrative lab panel. I should upload that too, actually. I'm gonna write that. Standard integrative lab panel. Basically, I do that, and and of course the standard CBC, CMP, lipid. He says, but I'll upload my lab panel, standard integrative lab panel. So that's what I do for every patient. And then for if I'm doing more functional medicine or immune kind of infectious workup, then I'll do more detailed stuff. Are you lithium because you stabilize all my moods? Do I make you pee too? And don't worry, I'll break your heart by causing arrhythmias. What's the most common medicine prescribed for harmful OCD? Probably a high dose SSRI. That's the most common for harmful OCD. How do you cope with the distressing moments of the job? Taking care of myself, good sleep, exercise, eating clean. Psych prescribed SSRI for anxiety. Oh, rip, I already lost it. Do you have any recommendations for insomnia, 3 a.m. wake up? Yeah, you want to do what's called CBT-I, cognitive behavioral therapy. Basically, cut out caffeine, Make sure you sleep and wake up at the same time each day. Don't have nicotine, especially close to bedtime. Don't eat too close to bedtime. Make sure your room is cool. That stuff. What can I ask my doctor for? I'm in the UK. Wait, rip, I already lost it. I'm in the UK, not much help. I don't want to request labs. I mean, it depends on the problem, right? Different stuff is for different, like you request different things to treat different stuff. I am on Lexapro, but I worry a lot. Is Lexapro working for me? It depends on the dose. Yeah, it depends on the dose. Yeah, because you can go Lexapro up to 20 to 30 milligrams. So, yeah. Thanks for the info on cyproheptadine. I downloaded an article from Cambridge. I will try it on my patients. Nice. Are you a provider, Meg? Hi, doc. Is Lexapro good for depression and anxiety? Yeah, it's solid. Usually 20 milligrams is like a good go-to dose. Is one SSRI better over others for excessive worry and panic attacks? Yeah, I think Zoloft tends to be just a little bit better because it's a little bit more calming. Paxil can be good too, but it's just hard to come off of. Thoughts on magnesium threonate? So, thoughts on magnesium threonate. It's good for relaxation and sleep, and calming. So I use it for people who are agitated or have difficulty sleeping. Like I take magnesium every night for sleep. You must be Effexor because when you leave, I get withdrawal symptoms and brain zaps. Well, don't worry, babe. That's why I leave slowly to ease you into it. I've noticed that some SSRIs can be activating more anxiety than others. Maybe it's not your kind. Yeah, that's true. So Prozac is definitely way more activating. Zoloft is like a middle activation. Lexapro's middle. Paxil's very sedating, and Lexapro's more sedating. Or not Lexapro. Luvox is more sedating. So it just depends. Is there anything to be done about Wellbutrin rage without going off the medicine? You could take propranolol. That can help. You could lower the dose, or you could start lower, or lower the dose. How do we taper? I assume this means Latuda 60 milligrams to Rexulti. So I mean, you could just cross taper them pretty easily. They're both antipsychotics, so you could just take Latuda from 60 to 40 and then start Rexulti. You could do a direct switch as well, if you want to, but I would just do a cross taper. I think patients just appreciate cross tapers more. But Latuda is a good med for treatment-resistant depression too. So I would also consider maybe increasing the dose. Like you can go up to 120 to treat treatment-resistant depression. So maybe the dose just isn't high enough. What do you do for night terrors in adults? Probably propranolol. Fetsima doesn't have a generic, but it's a newer SNRI. I'm not familiar with. I haven't used it personally. I use more of the older stuff. Tomorrow will be 2 weeks on Lexapro. I think you have to give it about 4 weeks. Lexapro is more neutral. It's not sedating or some people can be sedated, others can be activated, so it just depends. Can you talk about catatonia? Yeah, so catatonia is basically it's a thing where it's associated with psych conditions and patients will present kind of frozen. So I remember I had one kid, he was like a 15, 16-year-old kid. He had autism and he came in and his hand was just like in the air like this. And there's this thing where like they kind of just look there, like they're alive, they're aware of what's going on, but at the same time they're really dazed and out of it. And so this kid had his hand up and like you could move it wherever and he would just move it with you. So that's called waxy flexibility, where you can just move the hand and they can just move them wherever. and it's associated with psych conditions. I had another lady with schizophrenia who also had catatonia, and she was like kind of laying there, but like you could kind of move her hand and posture her, and she would just move it. And the way you treat it is with Ativan. Had the same thing. Yeah, it's definitely a thing for sure. Can I take magnesium long term? Yes, you can. Yeah, I take it all the time. Doctor of Advanced Doc of Clinical Advanced Practice, board certified in adult psychiatry. Oh, awesome, Meg. Yeah. Then I think you would really like our coaching program. So we have a coaching program specifically for nurse practitioners, NPs. So, yeah, so like that's what Diana's a part of. So she's asking some of those advanced med questions. So if you want to be able to like ask and discuss direct med questions with me, and really get like we have live Q&A calls every week. So if you really want to be able to do that and level up your psych knowledge and skills, I would check that out. It's in my bio. It's so rare, a sexy doctor. LOL. No, it's a ruse, I promise. Nice eye shields, planning on block the sun or the sparks between us. Yeah, yeah, you make mm, girl, I look at you and my I don't want to blink. That's why my eyes are so dry. So I need this. Honestly, my experience is between both. Yeah, exactly. It can vary. It can vary. What do you do for fun outside work? Nothing. I just work. Work is fun. But like that's what I'm saying, right? Is like life. So I think about life. Like life is like it's a video game. And so if I treat work like a video game, then it becomes fun because it's literally like the game that I'm trying to play and level up in. Any advice on MCAT? No, I took my MCAT 10 years ago. I took it in 2013, so 12 years ago. So my advice would not apply. Awesome. Sounds good, Meg. What is the typical age of onset of OCD for a child? OCD, I've seen, we're usually around like 10-ish. For the kids I've seen, all the kids present around 10. What are your go-to supplements for you patients? Omega-3s. I do omega-3s for my patients. I do multivitamin. The deficiencies like vitamin D and iron. I like magnesium a lot too. Very good for calming, very good for sleep. Those are some of the more common ones. But I like to start with the NAC. I use very commonly for OCD, anxiety. But I like to start with some of the foundational ones and then add in for any deficiencies. You look so young. Yes, I will definitely take that. I will take that as a compliment. If Klonopin is not as effective as it was, should I go to Ativan? I would assess the dose of Klonopin, to be honest. Ativan might be too high of it, or Ativan just like goes a lot of up and down. Where's them glasses? They're right here. Which country are you from? USA. USA, baby. I was born in India, but I live in America now. For NAC, should you start low and slow? Yeah, you should start 600 milligrams and then slowly go up to 2,400 per day. Why does NAC smell so bad? I don't know, because it's like a gross powder. I don't know. Earliest age you've seen prodromal symptoms in psychosis? Probably like 11 or 12. A friend mentioned she treats catatonia with clozaril. Can that be a treatment? Incorrect. No, clozaril is only for... it's for schizophrenia and bipolar disorder. mainly like treatment-resistant schizophrenia. You would use Ativan for catatonia. If antipsychotics create metabolic syndrome or pre-diabetes mellitus, can I prescribe melatonin? You may, yes. Yeah, I frequently prescribe melatonin already for metabolic syndrome stuff. And I've been thinking of incorporating more GLP-1 agonists, actually, like Wegovy, into my practice, or like Zepbound or something. I don't have that much experience prescribing GLP-1 agonists, but I think they're becoming more popular now. I think the craze is dying down, so they're more accessible. But I would definitely start, metformin is an easy one to start with, and it's way, you can get it approved by insurance immediately, right? Rather than the GLP-1s, which may require failing metformin, for example. Damn, these questions are racing in. So I would definitely also look at subscribing too. And so that way, for example, so Diana is a subscriber. And so because of that, like her questions stand out above everyone else's. Right. So I would definitely look at subscribing, and that way I can prioritize your question too. Because right now we have 119 people here. So definitely a lot. Don't lie. Which chat is better, IG or TikTok live? IG definitely gets a little bit rowdier, that's for sure. Metformin dosing, start at 500 milligrams per day. You can go up to 1,000 BID. Gone through 5 stimulants, had negative effects. Yes, Strattera often does well if stimulants don't work. You ever get tired of answering the same questions? No, because they're different people. If you specialize in anything, you're always going to answer the same question. Imagine like a really good mechanic, right? A really good mechanic sees the same issue like over and over again. So it's part of the game. Anything that you're good at, you do repeatedly. Have you ever prescribed antihistamines for psych issues? Yeah, we use hydroxyzine quite frequently. It helps with sleep and anxiety. Yeah, tons of questions. So there's no way, like literally they just keep like pushing through. How long did it take you to become a psychiatrist? So I went to med school. I went to college for 4 years from 2011 to 2015. Then I went to med school from 2015 to 2019. Then I did residency from 2019 to 2022. And then I did child fellowship from 22 to 24. So I'd say 13 years since high school graduation. Thoughts on Spravato? It's good for treatment resistance. So if you've tried some stuff and it hasn't worked, that's when I would look at Spravato. Do you prescribe melatonin as a prophylactic or just if the antipsychotic is causing weight gain? I would prescribe it as a prophylactic if it's a high-risk antipsychotic. If it's a low-risk antipsychotic for weight gain, then I would use it as a treatment. But I would discuss it with the patient too. Sometimes people want to go one way or the other. Are you a provider by any chance, Brianna? What if 50 milligrams of hydroxyzine? So thank you for the sub, Melissa. So see, her question stands out above everyone else's. What if 50 milligrams of hydroxyzine doesn't help with sleep? So you can go up to 100. Like I prescribe 100 frequently, sometimes even 150 for super severe. So there's definitely room to improve. Yes. Graduating PMHNP school in May. Oh, nice. Okay. Then yeah, you would definitely want to, I think, check out our coaching program specifically for NP students and PMHP students, because I find a lot of them tell me that they'll ask me, hey, can I precept you? Hey, or can you precept me? Hey, can you teach me psych? I didn't learn anything enough from NP school. I'm seeing all these patients and nobody taught me anything. My supervising psychiatrist doesn't really pay attention to me. My team thinks that I don't know anything. Like I've heard all these things. And so that's why I created a coaching program. So that way, you can learn psych from a psychiatrist and not feel like you are like left behind, or, that you didn't that you're not like keeping up with the team, and so you can actually like feel confident in your prescribing skills. So right, if you're someone who's like really interested in right developing your knowledge further as a psych NP, then I would definitely look at that. Answer me, please. What do you prescribe for anxiety drop attacks? I'm not sure what a drop attack is. Is that like a panic attack? Yeah, so I would definitely look at, here's Diana's question. If hypothyroidism, can I prescribe levothyroxine? If so, dosing, lab frequency. Yeah, you can prescribe levothyroxine. Start at 25 micrograms, you can go up to 37, go up to 50. Usually labs you can do once every couple weeks. Like levothyroxine is something that you can't really adjust too quickly. You have to do it a little bit more slowly. Yeah, but you can definitely do it. You can do it as augmentation for treatment-resistant depression, or just to straight up treat hypothyroidism. Like I've treated a couple cases of hypothyroidism. So yeah, it's not a hard med to use or to diagnose. I should definitely make a video on that too. Is Lexapro typically associated with less weight gain? Yes, it tends to be. How many in group coaching? Yeah, so we had 50 members join over the past couple weeks. So it's definitely, our program's definitely grown, right? So there's a lot of demand for it. But in the groups, like maybe like 6 people will join on the calls per average. So you definitely have the chance to ask all the questions that you want to. And everyone asks their questions beforehand. So even if you don't show up on the call, I'll still answer your question. And then that way you can view the recording and get the answer. So a lot of our members do that. Like they'll just ask a question beforehand, I'll answer it. For example, one person had a question like last week about, it was a case with like tapering antipsychotics, and so I answered that. Then another member had a question on it was like PTSD and insomnia. So we talked in depth about how to treat insomnia and PTSD. So you have the option either way. Thoughts on Effexor? I am on 75. Awesome, Cass. Thank you for the sub. I'm on 75. I think I need to up it. Yeah, you can up Effexor pretty easily. Effexor goes up to 225. So, yeah. TY, I get some pushback from providers. Yeah, I think most people are not that confident. That's the main thing. Even in psychiatry, like, I've worked with other psychiatrists who like will say that they don't want to treat ADHD, or they don't want to treat any kind of medical problems. But my view is that, hey, if you can do something to help the patient, at least, the way I think about it, like before I became a psychiatrist, I'm a doctor first. So that means that if I can treat a medical issue, then I will do that, right? If it's easy, it's in the scope of practice, and that furthers my skills too. So I wouldn't think about what other providers say, right? Because ultimately they're not the ones practicing or seeing your patient. And ultimately, you want to keep leveling up and you want to keep developing your skill set. Do you teach psych or just answer questions? Yeah, so I teach it in my mental health or my NP coaching program. So that's where I, teach psych to other providers. Why would some psychiatrists say you take ADHD meds every day and some say it doesn't matter? No, I don't think you need to take it every day. It just depends on how you're functioning. Much cozier vibes, yeah. It's just different. It's a different vibe for sure. But I think some of the Instagram is like the wild wild west. People be wild, and yeah. Hey, Psych NPCO, how are you? What state do you practice in? So I live in New York, but I have a bunch of state licenses. I do live in New York, but I'm in my parents' house right now. Yeah, because I came here. I'm gonna stay here for a monthish because I wanted to focus on my coaching program. So like I really just wanted to go focus on it though. So that's why I came here, eliminate all distractions, because my goal is to make it the best NP psych coaching program in the country, because oftentimes I've had so many people tell me that they just didn't get good psych education. And I was lucky because I went to residency, right? I had psychiatrists monitor me and supervise me for like every patient that I saw. But a lot of NPs have told me that they did not get that. So that's why I wanted to offer that. And so that's why I needed to develop it, right? So I had to focus. And yeah, that's why I came to Michigan to do that. Most common med for autism and ADHD comorbidity, probably like a stimulant. I use those pretty often. Heck yeah, exactly. You have to keep it professional on TikTok. Yeah, it's a different game, different vibes. We got 120 people in here Saturday night, Saturday night with the crew. Does Buspar need to be tapered? How about hydroxyzine? No, you don't really need to taper any of those. I mean, if you're at a higher dose, but you don't have to. Buspar is decent for anxiety. It's not the best, but you're not going to have that many problems with it. Does Buspar help with OCD? Not really. It's more like mild anxiety. Does Geodon lower the seizure threshold? No, not really. Not that I'm aware of. Wellbutrin does. That's the most common one. Geodon can increase QTC prolongation. Like, that's the biggest thing with it. I feel like Elevance makes me depressed when it wears off. I don't know what Elevance is. You mean Vyvanse or Elevil? Does Vibrate need to be tapered? Yeah, all the SSRIs should be tapered, all except Prozac. So any serotonergic medication. Yeah, Vibrate should be tapered, yeah. My doctor said lack of motivation is fixed with therapy, not meds. Kind of a mix of both. Thanks, appreciate that. Can you medicate for ADHD and anxiety? Yeah, of course. Stimulants for ADHD, anxiety, you'd use SSRIs. Lamictal and Effexor, it's fine. They use different. They have different mechanisms. I know everything about ECGs. Oh, nice. Then you know about QTC prolongations and how to read them and how to identify heart rhythms, that kind of thing. Do you have to taper off Lexapro? Yeah, I would taper off it. Does guanfacine make Vyvanse less effective? No, I don't think so. I mean, a little bit. A little bit, yeah. Saw serotonin syndrome today. Dang, that's not good. Also, weren't you gonna go out like Saturday night, Chicago or something? Was psychiatry your only choice? Yeah, I was only gonna do psych. I wasn't doing anything else. Should I take I don't know what Ziplixine is. My Lamictal causes hair loss. Any solutions? Yeah, I would lower the dose. Or just switch, honestly. Or you can use minoxidil or finasteride. I've prescribed those before. Do I take any meds? Only hair loss meds. Tips for constant anxiety, flight. Whoops, I already lost it. Tips for if anxiety is constant and it's causing problems, then that's where you look at meds. Why did my dad shit so much on my mom? I cannot answer, my friend. That's, I don't know. If you had to choose an anxiety med, what would it be? Like to take one or to be one or what? Laughter is good medicine. Sure. Yeah, it can be. It's a medicine. Is it bad to get the ick about someone? No, it's more like instinct. I mean, it can be overrated for sure. Should take Ziplicone. I don't know what Ziplicone is. You have to give the generic for that one. How do people overcome prolonged grief? I think they prolong it by taking care of their brain and then, finding finding their purpose again, right? Focusing on their own future instead of the past and what's happened. Long-term antipsychotics harmful? They can be, especially with weight loss and diabetes and things like that. But they can be helpful for like a patient like schizophrenia who needs it. Describe serotonin syndrome. Yeah, that's basically when you have too much serotonin, it can cause blood. Actually, I made a module on, I think there's in the program, if you check, I have a thing on serotonin syndrome. I think it's in the SSRI overview. So definitely check that out. I'm pretty sure I have that in there. But basically, it's when you have serotonin over stimulation, too much serotonin, it causes some, autonomic dysfunction, that's really the main thing about it. It's a condition that needs to be treated with hospitalization. Yeah, so all the information's in my bio, so that's the best place to check it out. And Tregel 443. So all the info's in the bio. What diagnosis can a person have? Rip, I already lost. Oh, with the act very weird and erratic after stress and trauma. I mean, it sounds like PTSD or acute stress disorder. How do you differentiate between OCD if it's just part of autism? OCD has more like compulsions and stuff too, and intrusive thoughts. Autism doesn't need to have that level of distress that OCD does. Why does Artane make me delusional? It's because it's an anticholinergic, and that causes loopiness. A lot of people will abuse Artane. Sertraline and olanzapine. Yeah, it's pretty solid. Why am I crying on Wellbutrin? I have no idea. Meds for ADHD. Stimulants, usually. How do I find psych professionals who are educated in what I need? I'm not sure. It depends on what you need, fam. Thoughts on lisdexamfetamine and topiramate? I mean, they're good for the right things. Is mirtazapine good? Yeah. Really, take 10 milligrams of Artane. Why? I don't know why you take Artane at night. Usually, Artane is used for antipsychotic side effects. It's not really like a sleep med. Is gaining 20 to 30 pounds on a normal side effect for olanzapine? It is, unfortunately. Yeah, weight gain is very common with olanzapine. That's the case where I prescribe metformin very quickly. Are the cues on a different social media site? Yeah, I'm streaming on TikTok. Is there a good way to treat ADHD naturally? Yeah. Keto diet, high protein diet. They gave it to me because I'm getting Brad hour or less on Seroquel. Yeah, that would be why. Yes, that would be why. Exactly. What do I do? So I'm a psychiatrist, so I prescribe, I treat mental health conditions through psychopharmacology and psychotherapy. I started venlafaxine, and the side effects were horrible, so I went back to citalopram. Nice. Yeah, Effexor can be hard to get used to. Natural remedies for OCD, maybe saffron. Try OCD, or try NAC. Melatonin good. Melatonin's good short term. I wouldn't do it long term. Yeah, thank you. Next. Do you recommend your career for high school graduates? I mean, if you're willing to commit to it, it's definitely a commitment though. Like, you can't really back down. Nowadays, if I know what I knew now, like, I would have just done social media, like, from the jump. If I've taken over 35 meds due to misdiagnosis, does this count as continued education? Yeah, I don't think you could get a CME from it, but, but every day you're learning, right? Every day is a day to level up. Do you believe medication is a solution or it's just temporary? No, I think a medication, like, it's imagine if you're stuck at the bottom of a well, then medication is like a ladder that drops down. So you can climb up the ladder and it makes it easier to climb up the well, but you still have to climb, meaning that you still got to do the work. And then when you get out of the well, then you don't need that ladder anymore. So that's how I view medication. I'm prescribed Klonopin for, that sounds like a lot. I mean, it's hard to give opinions, right? So that's where, like, if you want me to weigh in on your personal med situation, that's where I would recommend booking a consult. So you can do that in my bio. That's the best way to do that. Do we wait to collect prolactin levels only if symptoms of gynecomastia? Yeah, because prolactin levels don't really tell you that much, right? It's the symptoms that really tell you. Prolactin levels often don't correlate with symptoms. So someone could have symptoms of gynecomastia, for example, and a normal prolactin, or they could have high prolactin and not have any symptoms. So remember, you don't treat the level, you treat the patient. What would you prescribe for bipolar 2? You can use mood stabilizers and antipsychotics. You would just use milder doses. You mean you would have skipped psychiatry and only done social media? Yeah. Yeah, that's what I would have done. I'd have straight up just become a YouTuber after college. Like assuming I went to college, yeah, I would have become a YouTuber. Right? Because I always think about that. Basically, if you want to be successful in life and you want to be happy in life, you want to do something that helps other people and that can make you money in the process, right? Like that's the simple way to be happy. Help other people, have good relationships, friends and family, and be financially stable, right? Simple. So there's multiple ways to do that. Psychiatry was just one way. It's the way that I knew of at the time. But there's many other ways that would have been helpful. Why is it my ex got married? I didn't care for my situation. Got married. I got sad. Yeah, because your situationship probably gave you a lot more excitement than your ex did. Your ex probably, there's some excitement at the beginning, but then by the time it kind of fizzled out, that emotional roller coaster was gone. But with the situationship, it's all highs and lows. So then when that gets taken away, you have a lot more you're literally withdrawing from the situationship. So there's a lot more dopamine withdrawal than if it's from the ex. Any tips on how to use PRN benzos without teaching yourself to be afraid of anxiety? Yeah, use them only when things are really, really bad, and try to go as long as without using them. Can Wellbutrin cause floaters in vision? It's working great. I don't want to stop taking it. I'm not really aware of floaters with Wellbutrin. Tips for constant anxiety, lightheadedness / palpitations. Yeah, deep breathing, meditation. I would look into that. Propranolol can be helpful as well too. At what dose does doxepin start helping anxiety? We don't only use doxepin for anxiety. We use it more for sleep. But anxiety, you have to go to, I believe it's like 75. For sleep doses, we use like 10 milligrams to 25. Is bipolar disorder passed down to kids? Yeah, it's hereditary. Usually it does. Medication for ASPD with severe anger: Risperdal, Abilify, Guanfacine, Clonidine. Those 4. Have you read The Body Keeps a Score? I have, yeah. I read it in residency. Why are you anti-benzo? I'm not. Why are you accusing? Why do we even still use MAOIs? We don't really. I've seen one case of it in my entire residency. Nobody ever uses MAOIs. They're too hard to use. They cause blood pressure, so you can't even have cheese with them. So there's a lot of problems with them. What would make a prescriber use Wellbutrin alone over a stimulant for ADHD? Probably if there's depression issues or if they want to avoid a controlled substance. Or if they want to make sure you actually get access to it because of the stimulant shortage. Suggested medications for genital numbness associated with fluoxetine. Yeah, you could use, you could use Viagra or Cialis. You can use zinc supplement. I actually made a module on this in my coaching program. Basically, it's how to deal with the sexual side effects of SSRIs. So you can use zinc, you can use Viagra, Cialis, you can use lion's mane as well. Check your hormones, make sure your hormones are good. Buspirone you can use Wellbutrin as well too. Cyproheptadine, that's more for appetite. Do I have just ADHD, or I think I do? I mean, I'm not sure, but I see plenty of people for assessments, like ADHD assessments, ADHD treatment, second opinion. So if that's you and you want to get a consult, then I would definitely look at booking one in my bio. Would they ever use Wellbutrin and a stimulant? Yeah, you could use both. You could stack them. I mean, it's not ideal, but you can. Like if one doesn't fully control it. So let's say you have depression and I'm treating you with Wellbutrin and now your depression's pretty good, but you still need a little bit more ADHD help, then that's where I would use a stimulant. My hair is so slight today. Thank you. Yeah, yesterday everyone was like, "Oh, you got a comb over." So I was like, "Oh, F you too." Does Buspar work for OCD or natural supplements are more effective? I believe didn't you already ask about this? And Buspar does not work for OCD. Natural supplements use NAC. Yeah, I don't think cyproheptadine's a good choice for SSRI, like sexual dysfunction. Buspirone is better. What's the most flex question you can ask? That must be some Gen Z term. Like I don't know what that means. Flex question. I don't know. If I think of flex, I think of like Marvel Rivals. Like you can use multiple characters. Knack helps. Yeah, Knack is great. How do you know if my recurring thoughts are GAD or OCD? I don't. That's where you have to get an assessment. But basically, it's how intense they are and how repetitive they are. I'm a millennial therapist, but I work with teens. Haha. Yeah, see, there you go. Exactly. It's the teens, man. They'll, you're cooked, bro. You're cooked. Only way to overcome social anxiety is to out myself into social situations. Yes, it's called exposure. When I miss a day of Lexapro, I have severe withdrawals. Yeah, that's very common, unfortunately. That's why, yeah, that's why you gotta taper off them. I play video games. Yeah. I mean, that's one reason I came to my parents' house was because I was like, okay, I need to step away from games because I need to focus on this coaching program. But yeah, I was playing Rivals. That's the main thing I play. I also play single player games too. Like I was playing Horizon Zero Dawn before that. I beat Last of Us Part 1 like 4 or 5 months ago. Yeah, I mostly like single player games. I take sertraline 25 milligrams. Can I take ashwagandha? No, I don't play sports games, unfortunately. I'm not into sports. Like I've never watched a sport in my life. Like I've watched maybe half of the Super Bowl one year. So I've never been into sports games. Valorant, Lithium's great. Thoughts on ashwagandha versus propranolol? I mean, they're very different. Ashwagandha is long term. Propranolol is like in the moment anxiety. How old are you? How old do I look? My experience with SSRIs, Lexapro, fluoxamine, Prozac works amazing. Yeah, I like Prozac's my favorite. TBH. Sertraline worked for me 9 months, but not anymore. Yeah, there's a thing called antidepressant poop out, which can happen, so that can throw it out. Yeah, see, I think a lot of people already they know my age already. So see, the OGs know the lore. The lore is present in the chat. Metoprolol for anxiety. Now we only use actually. So Dan actually just wrote. I actually just made a propranolol module today. So it should be uploaded by tomorrow. So yeah, check out for that. But there in the module, I explain why propranolol is the main one beta blocker that we use in psychiatry. I'm 31. Where do we find the modules? So the modules for my NP coaching program. So it's for I teach NPs about psychiatric diagnoses and psychiatric treatments. So that's for my coaching program. That's where the module is. Coming out tomorrow. Do you recommend ashwagandha? Yeah, ashwagandha is good. I take it personally myself. It helps with stress and anxiety. But it's something you have to take for a while. It's not something you just do immediately. Like it's not something you take and then things get better, but it's like it happens over time. Can you experience a manic episode from an SSRI even though you never had a manic episode before? Yeah, you can. Are your glasses a combination of goggles and prescription lenses? No, they're literally just glasses, plus like a little. See, so like right now, if I do this, like it's just glasses. Like you literally can't even tell. So there's that. But then when you add these things in, these are for dry eyes, and so there's like a little magnet, and so it literally attaches, like the magnet attaches here, and then it attaches here too. And so basically it creates a little shield and it protects my eyes from drying out. So there you go. But it looks like glasses. Thoughts on L-theanine? It's great. What's one of your favorite questions to be asked about in your field? Oh, yeah, so one of my favorite questions. So my philosophy in life basically is that life is a video game. And so just like in a video game, you start at X or Y level. Like let's say you started at level 5, and then you fight stronger and stronger creatures as you level up. But let's say you fight a level 50 creature and you're level 40. Well, now you have to level up your character to level 50 to fight those level 40 creatures. And the way you do that is that you fight the level 40 creatures around you, then you get to level 41, then 42, 43, etc., etc., and then you keep leveling up. That way you can fight that level 50 creature. And as you fight that, you get better stats, you get better equipment, etc. And so real life is the same way, where you have some kind of challenge, right? Like, for example, when I was in med school, my undergrad study habits were not going to cut it anymore. So therefore I had to level up, right? To learn how to study harder, how to study more efficiently, had to absorb a lot more information, had to like level up skill of patient care, right? Had to level up my sleeping and diet and stuff. So that way I could be more focused and productive, leveling up patient care skills, like in college, leveling up social skills, right? And so those are all ways that you improve and you get better and better in real life so that we can handle that challenge that you're doing. So that way, that's what makes real life fun for me, is that like every day it's kind of like I'm leveling up and I'm playing the video game of life. And so that's my favorite thing in psychiatry to talk about. So if you think of real life as a video game, then you'll never run out of motivation, because the motivation is always to get better and better and keep playing. Hey doc, for your NP coaching program, are there recorded times to log in, or it's pre-recorded? So all the lectures are pre-recorded. Everything is pre-recorded. But we have coaching calls every Tuesday at 8 p.m. So that's where we log in. Like, you log in for the live coaching call. Like, so you can get on live and actually ask me questions, discuss cases, like patient, or like literally like last week we discussed cases. People were asking about, what were they asking me about? Here, I'll just show you actually. They were asking all these different questions, right? So, for example, here's the call that we have coming up. Here's a call we have coming up literally this week. So 4:15. So every Tuesday night we'll have our call, right? So for example, right? So Manu had some questions on weight gain by antipsychotics. So GLP modulator, right? So people are answering questions on anxiety, psychotropics, brand of L-methylfolate, so holistic training, SSRI and psychosis, right? Recommendations, tearing. So people ask questions beforehand, and so then I go through and we answer the questions in our coaching call. So every week we'll have a coaching call, and then so if you see here, right, these are all the coaching calls that we've had. And so, you just look through, right? These are the different coaching calls, and I literally answer all the questions. So that way I'll answer your question. If you hop on the call, great. If not, I'll still answer your question, and then you can go through the call afterward, and then do it on your own pace. So pretty much, right? So like that's the call, and so that's how it works. That way you have flexibility on exactly how you want to do it. So I hope that was helpful. What are 2 phones? I actually have 3 phones, so it's a little burner phone action. What about one for therapist? That's a good question. What would a psychiatrist teach a therapist? Like, what could I teach you? Hey, Michelle, thanks for the sub. So, thoughts on DBT versus medication in quiet BPD? Uh, I'm not sure what you mean by quiet BPD. I mean, like either or is the same. Like you try DBT, you try meds. Usually both will work better than one or the other. But DBT is definitely what you want to try first. Nice. I'll see you later then. Yeah. Yeah, but I think, of course, but I think now is a good time to call it. So I guess I'm getting pretty tired. I think we've been out here for about an 80 minutes according to my clock here. So I hope all this was helpful. So I'll be on tomorrow, of course. And so if you're an NP and you want to learn from me and you want to level up your own psychiatry skill, that and skill with treating with patients and be able to ask me questions and like get coaching from me directly, then definitely look at joining our NP coaching program. And yeah, if you're a patient and you want to work with me directly, like you feel like you like my approach, or you feel like we'd be a good fit to work together, then definitely look at you can schedule a consult in my bio, and we'll see if we're a good fit to work together. But yeah, otherwise, I shall see you tomorrow night.